Mi nombre es Juan Carlos Díaz,
Good morning,
soy
everybody.
asesor
I'm Juan
de
Carlos Diaz, the
inteligencia
General Consultant of
artificial
Data Engineering and
formando
Public Health,
parte de la Unidad
and
de
I
Prevención e
am part
Información en
of
Salud
the
Mental, liderada por Marcelo Agostino,
Information System and
y dentro del
Healthcare
Departamento de Evidencia e Inteligencia para la
Systems
Ciencia y
and the
Salud,
Department of Intelligence and Evidence for
dirigido
Healthcare
por
with Marcelo Agostino
Sebastián
and
García Saizó, que
Sebastián
les manda
Garcia. So accordingly, they
muchos
sent
saludos
you
y bienvenida
uh,
a todos ustedes. Este seminario sobre modelos de implementación de salud
greetings. Welcome, everybody.
de telesalud y telemedicina como parte del itinerario formativo de la iniciativa
So, as part of
de
the
alfabetización
informational
digital en la OPS.
itinerary of digital literacy
Es
of PAHO
un caso más
initiatives,
dentro de
this
esta
is one more
iniciativa que ha
case
venido
in
desarrollándose
this
muy
initiative that
fuertemente
has
durante el
been
2025
strongly
y
developing for
quienes quieran recibir
2025. And
información
those of you
o
who
estén
want to
haciendo en este
receive
momento,
information
estaremos
that
pasando la
may not
información
be having so far,
de cómo
we'll be
suscribirse y
handing over
cómo
information on how
ingresar
to
a nuestras listas.
subscribe and how to join our
El
lists.
estudio de la implementación es esencial para la
The
OPS,
implementation study
en
is
este caso de
essential
telesalud y
for PAHO,
telemedicina, que
in
nos
this
permite
case
traducir la
of
evidencia científica en
telehealth and
prácticas
telemedicine,
concretas
that allows us to
y que
translate
fortalecen
medicine in
los
concrete
sistemas de
practices
salud. Y
and that
la telesalud y
strengthen
la telemedicina
healthcare systems, and telehealth and
se han
telemedicine
convertido en una parte muy importante
has
del
become a
desarrollo
very
de
important
salud
part
digital. Entonces,
in
esos
the
temas
development,
serán
the
desarrollados
development of
en
digital
este
healthcare. So
seminario.
those are like the
Y quiero
settings to
agradecer
develop
especialmente,
during this
antes de
seminar. And
iniciar,
I
a
want to
Miriam Caracol y a
especially
Alicia
thank
Correa,
Miriam
Anita
Caraquali, Lisa
Serrano de
Correa,
OPS, que nos está
Anita
ayudando,
Serrano,
a Gaby Contreras por
that
todo el
is helping
apoyo
us, that Gabi
logístico
Contreras, for all
de
the
la
logistic
sesión,
support
así como
in
Mirna
this
Martí
session, as well as
por su
Mirna
ayuda en
Marti
coordinación de la
for
iniciativa de
her very
alfabetización
important
digital, y
coordination
Alejandro
of the
Farías, que
digital
estará
literacy
ayudándonos
initiative in
durante la
103
sesión.
AM.
Marca dentro de un itinerario
So
formativo
this seminar
cuyo
is
propósito
framed
es abordar temas de
within an
relevancia, actualidad y
informational
utilidad para el
framework
sector salud.
that helps us
Y
in the practice of
anunciaremos al
healthcare
final de la
sector.
sesión cuáles son los siguientes
And at the
seminarios
end
que
of the
hay
session,
en línea.
we'll be
Ahora
telling you
nos
what are the
acompaña mi
sessions
colega
in
Mirna
line.
Martí, el
And
doctor
Mirna
Bernardo
Marti is now
Rojas
with us,
Casarín de
Dr.
Perú
Bernardo Rojas as
y la
well,
doctora
and Lucina
Mariana
from Peru,
Ramírez,
and
viceministra de
Dr.
Unidad,
Mariana Ramirez, the
quienes
Vice
van a hablar
Minister
sobre este
from
importante
of
tema.
the
Paso la palabra a
Healthcare
Mirna
Ministry
para
in
la
Bolivia, and I
introducción
hand
de
it
este
then
seminario.
to
Adelante, Mirna.
Mirna,
Gracias.
who will
Bueno,
be
muchas
giving us the
gracias,
intro for this
Juan Carlos.
seminar.
Es
Welcome,
importante
Mirna.
también
Thank you, Juan Carlos. It is
mencionar
also important
que
to
el
mention
seminario
that
estará
this
en los
seminar
tres idiomas de
is
la
going to be held in the
organización
three
y cada
languages of the
panelista hablará en el
organization,
idioma de su
and every
preferencia,
panel
pero
member
ustedes
will
pueden
speak
seleccionar
in the
a
language of
través
their preference,
de que
but
el
then you'll be
globito
able to choose
en
in
la parte
the
inferior o
glove
donde lo
icon,
encuentren en sus diferentes dispositivos
wherever
para
you may find it in your
escuchar
different
el
devices, to be
idioma
able to
que deseen.
hear uh,
Bueno,
this
reitero
webinar
o
in the language
agradezco
you
siempre al
want to.
equipo
Once
que
again, I always
conforma
want to
todo
thank the whole
este
team
ensamble de este programa de alfabetización
that is working
digital
together with this
y
assembly and the
envío
program of
nuevamente sí
digital
también
literacy. And once
los
again,
saludos de
I
nuestro director
also
del departamento, el doctor
send greetings
Sebastián
from
García
our
Saizó,
department
y del
director, Dr.
jefe de nuestra
Sebastian
unidad
Garcia, and
de
the chief
Sistema de
of
Información y
our
Salud
unit
Digital,
in
Marcelo de
digital
Agostino,
health
y me toca
information
hoy
systems, Marcelo D'Agostino.
contar
And
un poco
today
brevemente
I want to
de qué se
surely
trata
share with
para
you
la OPS lo
what
que es
means to
brindar
PAHO
cooperación técnica
the
en
offering of technical
temas de
cooperation
telesalud.
on issues
Esto se
of
encuentra
telehealth,
enfocado en un programa
which are
de
contained
telesalud
in
que
a program
tiene,
for
¿no?
telehealth
Un objetivo que
that
es, por
has the
supuesto,
purpose
lograr un mejor acceso
of
a los
achieving
servicios de
better
atención.
access
Es un
to
programa
healthcare
que se
services.
basa en una
It is
definición
a
de la propia
program based
OPS de
on
lo
the
que es la
definition by
telesalud,
PAHO
que
on
son,
what
bueno, todas
telehealth
las
is all
actividades,
about.
servicios y
So it's
metodologías que
all
tienen que ver
the
con salud y que se forman
services
a
and
cabo,
methodologies,
se llevan a cabo de
activities that
manera
have to do
remota
with
con
health
la ayuda de las
and that occur
tecnologías de la información
remotely
y las
with
comunicaciones.
the
Esto
assistance
incluye
of information
particularmente
technologies
a la
and
telemedicina,
healthcare
la
communication. It includes
teleeducación, la
telemedicine,
referencia y
teleeducation,
contrarreferencia, bueno,
reference and counter
varias de las
reference, and cross
modalidades que
reference.
entran
So
aquí
it's
en
all the
juego.
modalities that are involved.
Para ello,
For
estructuré
that
un
purpose,
programa de
to
cooperación
be able to
técnica que también
structure
pueda después
a
ser
technical
un poco
cooperation
replicado en su
program
modelo
that
conceptual
can be a
cuando en
bit
los países
replicated
desde los ministerios de salud o
in the
desde las instituciones de
concept
salud
of
pública se
the
intenta llevar
ministries of
adelante
health and
a
public
nivel
health
local
institutions
programas
trying
que
to
tienen que
work
ver con
locally with programs that have
cooperación
to do
técnica con generación de conocimiento o compartir
with technical
conocimiento, con el
cooperation, generation of
desarrollo
knowledge, the
y
development,
el desarrollo y la implementación de plataformas y
and the
herramientas
implementation
y
of
el
platforms and
desarrollo de
tools,
las capacidades.
and
Son
the
como las
development
cuatro
of
grandes
capabilities.
áreas donde la
They're like the
OPS
most important
focaliza
four areas where
toda su
PAHO
estrategia
focuses
de
all of its
telesalud. Voy a pasar
telehealth
rápidamente a
strategy.
contarles
So I'll go quickly to
que
tell you a little bit,
en cada una de estas áreas un poco dónde estamos y cuáles
how
son
are we
algunos de los
going
objetivos.
and how are we
En
doing
cuanto
in
a lo
every
que
of
es
each
plataformas
and every
y
one of these
herramientas,
areas.
en la
Um,
conceptualización de
so in
que
terms of
uno
tools and
de
the
los ocho
concept
principios de la
forming
transformación
of one of the
digital
8
para el
principles
sector
of
de la
digital
salud y que
transformation for
forma parte de
healthcare
nuestra hoja
systems,
de ruta de
and that
transformación
is a part
digital,
of
habla
our digital transformation roadmap.
de los bienes públicos
It's talking
digitales
about
y
digital
en este
public
sentido el
assets
desarrollo de una plataforma
and the
que pueda
development
ser
of a platform
disponibilizada para todas las
that can
Américas,
be put available for all the
desde el
Americas,
país más pequeño al país más
from the
grande, que pueda
smallest
ser
to the largest
utilizada y
country.
adaptada, es uno de los
And so that is
hitos o por
one
lo
of
menos
the
de los grandes
milestones
objetivos que hoy están en marcha. Por eso hay una
and the
plataforma, lo
objectives that are
llamamos todo
ongoing
en
today.
uno, de
So it's
telesalud,
a platform of
que
all in one
incluye
in telehealth
un módulo para registros
that includes
médicos
a
electrónicos,
module for
principalmente
electronic
orientados a
records,
las enfermedades no
mostly
transmisibles, pero que está en
looking
un
toward the
proceso
non-communicable
hoy
diseases,
de
but
expansión
it's in under
para varios
expansion
otros
today
módulos
for
y que,
several
bueno,
other modules,
disponibiliza para aquellos
and
países,
it
aquellas
becomes available
regiones,
for
aquellas
those such
instituciones que
countries
no
and
cuentan
regions, those such
con
institutions
una plataforma,
that don't have
poder
a
apropiársela,
platform,
poder
to be able to feel it
adaptarla
as
y, por
around, to
supuesto,
adapt it,
siempre también solicitar
and of
la
course to
cooperación
always
técnica de nuestro
request
equipo
the
para
technical cooperation from our
avanzar en
team
este sentido.
to
Em,
continue
Asimismo,
and
también
making
está,
progress in that sense.
como se ve acá,
Also, and as you
también
can
tiene un
see
módulo que es
here,
el de
it
telesalud,
also has a
que
telehealth
asocia,
module,
digamos, la atención
which
específica
links
a
specific
distancia
care,
virtual
the
con el
online
registro
care
clínico.
and digital
Entonces,
care
es una
with
herramienta que
clinical
puede ser
records. So
instalada
it
también
is a
en
tool that
módulos
can
y que,
also
bueno,
be
las
installed in other
especificaciones
modules
son varias.
with specifications that are varied.
Luego, y acá, bueno, agradecemos a los
And
colegas
here we want to
de
thank
Uruguay que
all the colleagues from Uruguay
compartido
who
esta
have
foto.
shared this
Tenemos
photo.
otra área que tiene que ver
We have
con la
other areas that
adquisición
have
de
to do with
equipamiento
the acquisition
específico
of specific
para
equipment
telemedicina a través
for
de los fondos
telemedicine
rotatorios de la organización.
via the
Esta
organization's revolving
valija, como
funds.
la pueden ver acá, es una
And this
valija con
toolkit,
algunos accesorios
as you can
extra que
see,
pueden ser
has external
adquiridos, que,
elements that
bueno,
can be
incluye
acquired, and
varios
it includes
equipos que son equipos
several sets of
fundamentales
equipment
o
which are
esenciales para
essential
poder hacer una atención remota
for
e
a
interconectar
remote
estos equipos a las
healthcare to
historias
reconnect
clínicas
these
o
devices to
a las
clinical
funciones
records
específicas de telesalud.
and
Por
specific
supuesto que en
care
cuanto
to
a la
telehealth.
generación de conocimiento, además, ¿no? de tener
Certainly,
y la difusión de
generating
conocimiento a través de este
knowledge and the
programa que
conveying of that
incluye el
knowledge
tema de
is
telesalud.
the
Desarrollamos
inclusion of these
constantemente
elements of
herramientas,
telehealth where we
documentos
develop tools,
y
documents
que los ponemos a disponibilidad
that
de
we
toda la
bring
región
to the
como
availability of all the region
guía para
as a guide
implementar una estructura básica de
to
telesalud,
implement a
cómo intercambiar entre
telehealth basic
países
structure
conocimientos
and how to
acerca de las experiencias de
exchange
telesalud
knowledge among
y
countries
herramientas también como
in
la
telehealth
herramienta que
knowledge, and
fue
also
tan
tools,
utilizada durante la pandemia,
one that was very
sobre
much used
cómo
during the
medir la
pandemic,
capacidad de las
on
instituciones a
how to
poder
measure the
implementar
institution's
la
capability
telemedicina.
to implement telemedicine.
Esto se complementa, por supuesto,
This, of
con
course,
la
complements
alfabetización digital, que es
with
nuestro
digital
pilar
literacy, which
y
is
lo que nos
our
convoca hoy,
most important
que
pillar that
son
gathers
estas
us
actividades
today.
sincrónicas en las que estamos
With all
participando y
these synchronized
agradecemos
activities we are
profundamente a
partaking
ustedes por
from, and we
prestarnos su
thank you
tiempo,
all for giving
y
us
también cursos
the space of your
que
time,
están
as
disponibles
well
en nuestro
as
campus
courses
virtual.
that are available in our
Cursos
online
de, por
campus,
supuesto,
courses
telesalud
of
específicamente,
telehealth
y este lo
specifically.
recomendamos a todas las personas que están interesadas
And this
en
is
el
something we
proceso.
want
¿Por
to
qué?
very much
Porque es un
recommend for
curso basado
those
en
that are
modelos
involved
de
in the process because it is
simulación y
about
gamificación o
modules of
gamificación,
simulation and
y
gamification,
que fue diseñado
which was designed
por varios equipos de
by
profesionales
several
especialistas en el
teams of
tema.
professionals who are
María Alejandra, que
specialists in
nos
the
acompaña,
topic.
fue parte de ese
Maria
equipo, fue
Alejandra,
de
who
ese
is here with
equipo,
us, was a
y
member of that
es
team, and there are
curso
several teams.
inmersivo en cómo
So
ser
it's
parte del proceso de
a
telesalud, cómo
dive-in
brindar
course on how to be a part
una
of this process of
específica, una
telehealth and how to
sesión de
provide
telesalud,
a
¿no?
specific
De
care.
ambos
It's a
lados.
telehealth
Entonces,
session that
por
involves
supuesto que
both
los
sides.
invitamos, saben que se certifican
So of
con
course we
campus
provide
virtual, tienen un
certificates
certificado
with
y que
the
además todos los
online
cursos de
campus.
campus
They have a
virtual son
certificate and all
gratuitos.
courses are for
También
free.
tenemos cursos de introducción a los sistemas de información para la salud, que por supuesto incluye
So
el tema
we
de
have
telesalud,
systems for
y
telehealth.
el
Of
de
course, it
los
involves telehealth per se,
8 principios, así como ya más
and the
básicos
8
de
principles,
interoperabilidad y
and some more
estándares que son
basic
necesarios también para
interoperability and
entender muchas
standards
veces por
involved,
qué
which are
algunos
necessary
equipos
to be able to
funcionan
understand
o
why
no
some
con los
teams
sistemas que nosotros
do
tenemos disponibles en
respond
nuestro país, esos
to
sistemas
some
telesalud.
devices and why some
Es una
devices
herramienta
are
muy buena para
responding. It is
entender
a
a
very
veces los
good
conceptos básicos
tool to
necesarios.
understand
Y bueno,
the
el de gestión del
basic needed
cambio
concepts.
específicamente
And
para
then
el
change
tema para
management
implementar la
specifically
telesalud.
to implement
Esto es
telehealth.
un programa, y con esto voy
This
a
is
cerrar.
a
Esto es un
program, and I'm going
programa
to
que
finish
intenta
with this.
abarcar las necesidades que hoy encontramos
These
en
are
los
the
países.
needs
Necesidades de de fortalecimiento de
that
las
we're trying to
capacidades,
strengthen
necesidades de
capabilities,
implementación de programas a niveles ministeriales e
and the implementation of
institucionales,
programs at a
eh,
ministry and
porque la
institutional level.
telesalud siempre estuvo muy vinculada con
Because
instituciones
telehealth
en
has
particular
always
y no
been very
muchas
much
veces con
linked
organismos de
with
salud pública.
institutions
Entonces, con
and
todo
not
este
oftentimes with
acompañamiento,
public
lo que
entities. So with
la
all of this
OPS
work, what
apoya es
PAHO is giving
específicamente a
support to is
países en este
specifically
proceso. Y por
countries
supuesto,
during the
el
process.
apoyo también en la
And of
adquisición
course,
de
support
equipamientos
with the
a unos
acquisition of
precios por ahí más
equipment and
accesibles,
devices that can be more
porque
accessible
son comprados a través de los fondos rotatorios.
because
Y
they
por
are
supuesto
purchased via
también
the
el
revolving
tener
funds. And of course,
plataformas
having
accesibles y disponibles para todos
platforms that
aquellos
are
que los
accessible and
necesiten
available
y que no puedan afrontar altas o adquisiciones de
and
alto
that
precio en
cannot
cuanto a
face
lo que son,
high
¿no?, las
price acquisitions
plataformas propietarias
pertaining
que por ahí
proprietary
están en el mercado
platforms.
y que muchos países o regiones se ven con dificultades de adquisición.
And then
Así que
sometimes they
bueno,
face
esta
difficulties.
era un poco la idea de contarles
So this was a
esto
little bit
y dar un
a moment to
inicio
share
a
this with you
esta serie de
and start with
actividades.
this
Esta es la
series of
primera, quedan
activities.
dos. Este es un webinario
And this is
internacional.
an international
Y
webinar.
le doy la palabra entonces
And
a
so now I hand it
María Alejandra
to
Farías, que va a ser la
Maria Alejandra
moderadora, y
Farias, who's
reitero
going to be the
una vez
moderator.
más el agradecimiento a todos los que nos dan su tiempo para escucharnos. Muchas
And
gracias.
I thank you all for giving us your time. Thank you.
Muchísimas gracias, Mirna, por la presentación del
Thank you,
programa y
Mirna, for
todas
the
las líneas de
presentation
cooperación que
and the program
tiene
of all the
la
lines of
unidad. Ahora
cooperation
le
the
vamos a
unit
dar
has.
la bienvenida al doctor
We now want to
Leonardo
welcome
Salinas, médico
Dr.
cirujano de la
Leonardo Rojas, a
Universidad
surgeon from the
Nacional de San Marcos,
National
especialista en
University
administración y
of San
gestión de
Marcos,
salud,
specialist in management and
magíster en gerencia de
administration
salud,
and
candidato al
with
doctorado en
masters in
administración de salud
healthcare,
pública,
a candidate to
docente
public
investigador, coordinador
healthcare
del grupo de
doctor,
investigación
a
de
PhD,
tecnologías de información en salud
and a
y
researcher
profesor
of
asociado del
information
Departamento Académico
technologies
de
and
Medicina Regenerativa y Salud Pública.
an associate
Exdirector
professor.
ejecutivo de
He's
la
an
Dirección de Telemedicina del Ministerio
former
de Salud del
executive
Perú.
director
Preside
in the
actualmente la
Peruvian
Comisión de
Ministry,
Transformación
and
Digital e
he
Innovación del
is
Colegio
leading
Médico del
the
Perú
Digital
y la
Commission
Comisión
and the
Nacional de Salud Digital,
medical
Inteligencia
school in
Artificial y
Peru
Salud
with
de Educación
artificial
Médica
intelligence
de la
and
Asociación
medical
Peruana de
education
Facultades de
from the
Medicina,
Peruvian
el jefe de la
Association of
Unidad
Medicine
Telesalud y el
Faculties
jefe
and the
de la
chief
Oficina de
of the
Tecnologías de
unit of
Información y
telehealth
Educación.
and
Muchísimas gracias,
the
doctor, por
technologies of
estar
information and
en
education.
esta serie de
So thank you
webinarios
very
y
much for
escuchamos
being in these
atentamente su
webinars,
presentación.
and we're ready to hear your
Muy buenos días con
presentation.
todos.
Good morning,
Muchísimas
everybody.
gracias. Reciban
Thank
un
you very
saludo
much.
cordial desde acá de Lima, Perú.
Greetings
El día de
from
hoy
Lima, Peru.
ha amanecido un poco nublado, pero
Lima appears to be quite cloudy today, but we're very happy to be with you during this activity. And I want to thank PAHO, first of all, for the carrying out of these sorts of events that are very important, particularly for our country's healthcare professionals. We are in a great need to strengthen our capabilities in this topic. So I want to thank Marcelo Agostino and Mina for the organization. I've been asked to talk about the models of implementation in telehealth. And so I wanted to show this chart, first of all, because when we think about the use of information technologies in healthcare, many of us think that that's telehealth. And that's not so. There's a group that is much larger than telehealth, which is digital healthcare, and it is the use of technologies to improve healthcare services for the quality of life for people. And there are other small elements, mobile healthcare, for instance, and in Peru, we have a framework act on telehealth, and there are other standards that have been evolving in time. So the beginning of the year, and as a background, we had an editorial in a journal about the evolution of healthcare, digital healthcare, and we titled that Breakthroughs in Intelligence. After the pandemic, telehealth became a very important element to be able to provide healthcare services amidst this global crisis. And when we talk about healthcare in Latin America, oftentimes we're not talking with one another in the same language. For Anglo-speaking countries, telehealth has a different definition. Components of healthcare in Latin America are different, as we can see in this image. So it is also very important that we can get to standardize some of the processes and terms, and particularly with the processes, to be able to do this for these, which I think it's very important with these implementation models. When we were talking about the normative standards that have evolved in Peru, since 2003, we have been having a series of standards regarding healthcare. And so, of course, there's an important milestone in 2016 where we have a framework law in telehealth. But I wanted to highlight this and look at the number of standards in 2020 regarding telehealth. And that's because in most countries of Latin America, normative agreements have had to be conducted for telehealth to become a reality. Before the pandemic in Peru and the Ministry of Health, back between 2016 and 2020, we had 25,000 patients responded to, and then after the pandemic, we have more than 52 million services of telemedicine that we responded to. So all this has shown the needed arrangements for telehealth to come to be, and to prevent this, which is very super important, which is a digital gap in healthcare. Oftentimes we think, and we were talking about that recently, talking about artificial intelligence, that artificial intelligence, some people said, is making gaps a lot deeper. And that's possible because the fact of not being able to access certain technologies will really restrict us not only in the use of technology, but also in the exercising of some rights, education in healthcare, the access to several services via technology. So it is very important to be able to identify who are those individuals that cannot access to it and develop a plan. Amongst the most important documents in telehealth the last years, we have BID in a study in Latin America with telemedicine, where Dr. Almicina will be showing some of these topics. And something very important that I also wanted to mention was the study of international telemedicine in Latin America, where we have interviewed key actors to be able to understand what would be the most important aspects for telemedicine to actually work as a whole in the whole Latin America. So that's really important, and it has to do with the various aspects that are needed to implement a service of telemedicine. So there are three key aspects. We have the context. I need to understand what is the context I'm going to provide this service. And the most important characteristics of my population are important to consider. The factors of process, what's the content that I'm going to provide as well. And there are a series of models for that. In 2016, we had this hat-like model that has an important idea, and that is how we go from the designing of the strategy to the implementation. And then in Australia in 2015, they also came up with the putting together of this framework in a digital structure for the ISO to be able to implement telehealth. And as you can see, there are several elements. We have infrastructure, healthcare services, processes, etc. Dr. Walter Curioso, who a Peruvian doctor and the Ministry of Health developed this model for telehealth, and this has been published. There's also standard regarding this framework. And what's different about this with the ISO framework is that it incorporates the pillar of human resources and some organizational processes the ministry also has, but then both PAHO and the Inter-American Development Bank have been developing this framework, which we call the digital little house. And then after the pandemic, or actually during the pandemic, it has been improved and then published. With this digital little house has these 6 key elements with infrastructure, application of digital services in the sector with telehealth, and there, of course, the pillars of people and culture, and then governance and management under the practice as the roof. And then, as I said, during the pandemic, they obligated all countries to develop frameworks that would implement healthcare services. And during the pandemic, these frameworks were developed. They were, for instance, identifying key aspects as audiovisual platforms, the coding and billing for different services. And these are very interesting topics. Mexico has a guideline, for instance, to be able to implement or plan the telehealth project. A very interesting guide, which is very nicely structured. For those of us who have studied in our diploma course in telehealth, we found it very interesting and it's very important. However, I think the model that actually consolidates all these concepts and it also simplifies them is this one, the World Health Organization published in 2022. This model of or implementation guideline is divided in situational analysis, the implementation phase, with also the third phase being the monitoring and evaluation. Very practical, I must say, because it gives us all the needed steps to implement a telehealth service. And the situational analysis, which is very important, and that here in Peru, we have developed as part of our own analysis. We have the evaluation of the level of maturity in the telemedicine healthcare service. So we worked with a quick adaptation of these evaluation, and that way we established levels of maturity in these services. We conducted a national survey of about 1,000 healthcare institutions to bring together information that would have statistical relevance in the findings that can also be representative for the whole country. And in fact, for what we found, our results show a level of a very low level yet in globally speaking, and in some domains we started becoming better in the level of maturity. Then we run some other surveys to identify the level of maturity by region. And we were gladly surprised. It was an interesting surprise, like the greatest levels of maturity. We found Lima. Of course, it has more access to resources, training, and technology. But we also found that Lima was also showing the most efficient results in some institutions, which really sent a lot of warning signals to us. So not necessarily because it's in the city capital where the most resources are present, will they have the best preparation. In terms of implementation, and something paramount for me is this scheme of Rogers in terms of the conveyance of innovation, meaning that every time we're going to work with an innovation, we'll sometimes have a small percentage, which are the innovators bringing the new technologies, but there will also be the early adapters. And these are key in this scheme because these are those that believe in that innovation, that are willing to use these new technologies to make them their own and to incorporate them into processes. These early adapters are key because these are going to be our champions. These are going to be the people who are going to help us disseminate this information. Sometimes, as physicians, we are not as open to hear another kind of professional or an engineer or architect, something like that, because it's a little different. But when we hear a colleague of us, someone working at a hospital and a healthcare entity, saying that they're doing good, that pretty much forces us. It's probably like touching our ego to work with it. And so this tool, the Rogers scheme, is very important for me. And within the different stages and activities suggested by this guideline, we find the deployment, the integration and interoperability and the information systems and the use of standards, uh, international by preference for the scaling up of it are key. Another interesting element, and going back a little bit to the study we conducted in Peru, is that we were also able to identify these aspects and the maturity of healthcare services to see which ones were related to the actual production, what aspects of maturity then were intended to do more out of this telemedicine service. And the most important aspects were organizational preparedness and human resources. It's just that in Peru, as with many countries, when we talk about telemedicine, we're always thinking about investment in equipment, connectivity, which is good. It's okay because without connectivity or equipment, you couldn't do it. However, institutional arrangements like defining shifts for the scheduling of telemedicine, local arrangements and standards that regulate them are important in the training of the human resource for them to have the confidence to use these technologies and provide the service as a long distance service. It's paramount. In terms of monitoring and assessment, I must add to the studies that we conducted that it is not a secret for anyone that the management of chronic patients is very important in a telehealth medicine system. And we wanted, with this slide, to be able to identify the role of telemedicine versus the in-person care, to see what was the role of it to be able to achieve a more sustainable in-person care, or at least a consistent care to at least 4. And it was showing that telemedicine had an 83% more probabilities for more response to the patients. This is a good evaluation of the service, telling us that telemedicine allows chronic patients to make sure that they have a continuous care, that they have more commitment and more access to our organizations. And we even went beyond. What happens to those patients that have a potential cancer diagnosis? So some countries call this a teledictia. It's an access that the doctors will have to be able to define whether a possible cancer or potential cancer diagnosis versus a definite and final diagnosis of cancer, they were able to reduce in 31 days the access to that diagnosis for patients that have screening done. And in breast cancer, a reduction of 43 days in access to diagnosis. So if a person was taking 60 days and having a response to go into from a potential to a final diagnosis of cancer, doing it in telemedicine was reducing in about 60 days. So for the treatment, from the moment to diagnosis to treatment, for the case of cancer, the interconsultation was 60 days, and in breast cancer was 74 days when they were working with the telemedicine. So it's a very important allied, not only for the diagnosis, but the timely treatment and in the end for mortality. So we run a follow-up in this case for chronic patients that were lost in the Ministry of Health in Peru, and we were able to establish that with telemedicine and in-person care as a combination, as a hybrid, we found that we could reduce a 9% of mortality risks in our patients, which is confirming some of the concepts that we also talked about during workshops. And that is that telemedicine is not replacing in-person care, it complements it. And this is paramount in the process of implementation and assessment, where telemedicine it has not come to replace in-person care services, but to improve access, diagnosis, treatment, and mortality. And then I want to wrap up my intervention with this slide. This is a publication by the WHO as well, very recently. It's last year in December, where they're telling us something that's very powerful for me to help decision making with an investment of 24 cents of a dollar per patient per year in 3 key areas: telemedicine, mobile messaging for the reminding of treatments, etc., and chatbots for the managing of mental health care. The impact is 2 million of lives a year. This is a measurement for 10 years. A reduction of hospitalizations in 7 millions of events. Economic growth with 199,000 millions of dollars saved and $5 million of years added. So with this intervention in our healthcare services, it's not only about saving costs or improving healthcare services, but also saving lives. And so with that, I finish my presentation. And if there are any questions, I'll be ready to respond to them. Thanks for your attention.
Bárbaro. Muchísimas gracias,
Okay.
doctor Rojas.
Thank you so very much, Dr. Rojas, for the excellent presentation and all the information you've provided of what's happening in Peru. And now we welcome Dr. Mariana Ramirez. She's the Vice Minister of the National System of the Healthcare Ministry in Bolivia. She's in charge of launching innovation policies toward a global healthcare system that is free and her leadership promotes the strengthening of primary healthcare networks and the strategic use of telemedicine to close access gaps. Welcome, Doctor. We are ready to hear your presentation. See my presentation. Okay. First of all, I want to thank the organization for your invitation once again. With this presentation, we want to be able to show some of the breakthroughs the countries had in terms of the implementation of telehealth in Bolivia. To us, it has been quite an important change in public policies because geographically speaking, Bolivia has quite a dispersion geographically speaking, as I said, and also in so many other settings. So to us, the National Telehealth Program incorporates these technologies of innovation with the idea to reduce social inequality in even in rural dispersed areas, which forces a lot of people not to be able to access specialists or subspecialists in our country. making, as the colleague in Peru said, that reference takes a while in being achieved, and for a patient to take too long in being taken care of at a healthcare entity. So this program is intended for the closing of this gap and helping people access specialties and subspecialties today, offering almost 80 specialties and more than 70 subspecialties and consultation. With the structure already mentioned that we have implemented in our country, telemanagement that has helped us grow throughout the years, and the implementation of services, telepidemiology that during the pandemic was not only linked to telemedicine and telemedicine care, but it has also brought a lot of impact for analysis in all of the corners of the world, of the country, and teleeducation that from the pandemic on has become a reality. A summary of what's happened here in Bolivia, and certainly before 2014, people living in rural dispersed areas had pretty much no access to a specialty and subspecialty services. And from the creation of the telehealth program, we started with telemanagement to work with everything needed for people to have the needed supplies and assets to implement the teles in all municipalities of the country. The epidemic has certainly been key for a very strong presence in the country to articulate healthcare systems, emergency health has been paramount in the management of healthcare systems during the pandemic, and unique healthcare system to guarantee free of cost services and the normativity for tele centers and superior levels even for rural areas. And right now we're having 271 first level healthcare centers with 62 second level hospitals and 21 third level hospitals. We've covered almost all the municipalities in the country, 338 out of 340 with coverage and 367 telecenters in our national network. This is a little bit of the constant growth that has also come along, the creating of conditions, networks, and internet services almost in all municipalities of the country, but also the providing of equipment and devices, and all of what we've had to have for people to start trusting a system that was not conventional and that it was also ready to provide healthcare responses with a great guarantees to be taken care of by an important specialist. So this is how the levels of care have been put together in the whole country. And these are the responses we've achieved since 2020 up to now in telemedicine, with 155,000 and change of services provided within the telemedicine offices, and also with the campaigns being conducted in all community centers teleepidemiology, which is today not only helping us with communicable diseases, but also with chronic diseases and non-communicable diseases. Telemanagement, which thanks to it, we've been able to create more telecenters, and teleeducation, which as of the pandemic has had an important growth with nearly 200,000 beneficiaries, to which we have provided training in several healthcare areas. So within the telecenters, we have maternal healthcare as one of our medical priorities, children healthcare, chronicles, and non-communicable diseases and other pathologies, communicable diseases. And we focus very much in people with disabilities, which are captured by search mechanisms, trying to apply our subsidy policy with community, intercultural, and family healthcare, where we can have an approach, a according to the local needs to be able to achieve a better capturing of patients, and then generating coverages that allow the continuous improvement of communities' healthcare. Among those who are beneficiated in 2025, we have reached more than 1 million people that are taken care of by telemedicine. The specialties in telemedicine, pediatrics, we can see how this has impacted the telemedicine coverage for patients with the before and after. In telemedicine went from 9,000 patients to more than 48,000 so far. So to us has truly meant a transformation of our healthcare medicine systems with technologies that come together not only for diagnosis, but also for the search and of pathologies that could be preventable. One of the most important examples that we want to position here are the fairs being done for telehealth, the online fairs. For instance, I'm going to share with you the ones we've had, where the population of dispersed peri-urban and rural areas would almost never have access to this kind of services in the past. And so this first online fair was attended by 232 patients taken care of in 3 days with the predominant diagnosis of anxiety and depressive syndromes, the prevention of 4 attempts of suicide because of a timely intervention of our third-level specialists who have given follow-up to each of these cases, and family psychotherapy sessions as well. There have been restricting factors, like for instance, some patients declining of the service, issues, the signal, the internet signal. And so the impact in general has been that the system has strengthened through these capturing campaigns to bring awareness to people in terms of mental health care, but have also allowed to access specialists for patients of high-risk conditions as well. This is our flow chart and the online fair where we are working with community research in the municipalities, selection of cases in the first level of care, online connection in the hospital of hospitals, which is our third level reference hospital here in La Paz. The psychiatry and psychology specialized care is also conducted, mental health care guidance, and then the follow-up to be able to identify risks in patients, and then in-person treatments, depending on the patient's risk, which if it doesn't represent any physical risk, then it can be done online in the rural area. What are our lessons learned? Well, virtuality has allowed us to reach a wider audience. The active participation of doctors, nurses, and the communities as well. This has shown that there are topics that are quite demanding, are at their level, and we should close this gap the most possible, both in the creating of and the bringing of awareness, education, and care, in this case, for mental health. The experience created foundations for other areas of healthcare for future virtual fairs. We've been able to identify high-risk patients. For instance, our children with birth cardiopathies, with hemophilia, with terminal conditions, which will have a similar structure in the conducting of virtual fairs. What have been the recommendations for future fairs? Well, to develop a wider communication strategy to be able to have a wider capturing of patients and for people to actually consolidate the confidence they have in the service, to strengthen digital literacy of participants and facilitators, to incorporate interactive tools to improve participation, to integrate online assessments to measure impact and satisfaction, and to replicate the model in other priority topics. Our most important conclusions were that the telehealth program has consolidated in the country as one of our more robust programs to provide access to high complexity healthcare services. And so it's not any longer a small pilot program somewhere. It's grown importantly in the whole country, and it allows us today to have tools to solve public healthcare issues. We've expanded our coverage in the farthest areas. FAIRS have become a methodology for early capturing of patients that suffer from pathologies that would have otherwise been identified much later without these kinds of services. And of course, it provides for the rights of healthcare with equity and universal coverage. Thank you. Thank you, Dr. Ramirez, for this wonderful presentation, as well as Dr. Rojas. This is showing the evidence of the value telemedicine has for our region and the possibility for innovation within telemedicine with the healthcare fairs and all the tips that Dr. Rojas has provided for the implementation of successful models. We have some time, remember, so we may have some Q&A sessions for both doctors. Dr. Rojas, a question. In your experience, how is it that you have been able, or what are the key factors that explain the positive impact in the times of diagnosis, and what conditions should be replicated in other countries of the region to achieve similar results? Okay, so key aspects for the interconsultation to not have issues of time for diagnosis and treatment is working in the processes. Something we also were explaining in our workshops beyond having obviously access to internet and technology, but the processes are key because they will allow us to optimize timing and perfect the flow of information so that information can get faster to those that have to make the decisions, which are the healthcare professionals and physicians who are going to have the information for a decision making in the situation of the patient. Oncological patients, for instance, these are patients that are considered within a network of oncology, but the facilities that have critical or specialized services aren't that many. And the capital and in the other regions don't have as many oncology services. So for a patient to reach or to have access to these facilities, it really takes long, several days for the entity to receive them. Then there's the labs, there's the proceedings. And so technology in this case allows oncologists to have contact with the patient, and they may be at work, they may be at their homes, and then they'll be able to save time so that at the end, the in-person consultation can be more efficient in terms of time and obviously aspects of opportunity in the response. And in oncology, time is critical. Thank you, Doctor, for your answer. We now have a question for Dr. Ramirez, particularly considering the geographic and demographic diversity in Bolivia. How was it possible to work with telehealth with far communities or rural communities that have no access to internet? How did you solve this? And to reach the very farthest communities. Thank you. So we have worked hard with another sector in a country, specifically in charge to provide access to internet. And that has been very difficult. Hence, the transition from 2014 to 2025 has shown a permanent effort in order to achieve coverage to areas that have been identified as priority to have internet. In Bolivia, we have a way of administration that is a bit complex. The autonomous framework law is going to tell us that the municipalities are the one that have to guarantee access to internet. So with the program, we have agreements that can help us generate access to internet from the farthest areas closest to each municipalities, and where they have to guarantee the conditions for us to bring all the technology and the installed capacity for the telecenter to operate. Some modalities in technology have shown to be interesting, like for instance, the one that we call the suitcases, and where we take these devices and stuff. That way we can provide care with these portable devices at a specific location, and then when we have one place with internet access, we can show the images acquired, and we work coordinatedly with the healthcare staff and the patient. So our objective is to be able to provide the that care with places, and there are places that have no services and nothing gets to those communities, not even cable Ethernet connection. And so our healthcare brigades programs are helping to provide care and help with the interconsultation, and then with the work of continuous access to control and the monitoring of those patients.
Muchísimas gracias, doctora Ramírez.
Thank you, Dr.
Le
Ramirez.
agradecemos a todos los
And we want to
participantes
thank
y
all
paso
participants.
la palabra
And
a
now I
Juan
hand it
Carlos
over to Juan
para el
Carlos
cierre del
Diaz
seminario. Muchísimas
to
gracias.
give us a wrap up of our seminar
Bueno,
today.
muchas
Thank you very much.
gracias. Estoy muy
Thank you
contento
very much.
de
I am very
estamos
happy.
celebrando hemos
We are
batido un récord, yo creo, de
celebrating
participación el día de
because
hoy
we
con
have
casi
had a
500
lot of
personas,
participation, or we have
¿no?
had almost 500
Sí,
people
casi
with us
500.
today,
Y hemos
um,
escuchado tres
which is a
experiencias
record
muy
for us. And
valiosas
we've
sobre
heard
telesalud en
very
nuestra región.
important experiences, three very valuable
Mirna
experiences in our
primero habló
region.
de los
Mirna
materiales del programa
talking
de
first
telesalud de la
about the
OPS, una
materials that
explicación muy
PAHO offers for
interesante,
telehealth,
y
a
todos
very
los
interesting
materiales que
explanation
hay que se han
of it, and all the
producido para
materials that have been
apoyar el
produced and are
conocimiento
available to give support
y la
to
creación de programas de
the
salud
knowledge and the
y para apoyar
creating
estas
of
iniciativas.
healthcare
Luego tuvimos
programs
la
and to give
participación del
support to
doctor
these sort of
Leonardo
initiatives.
Rojas,
Then we
explicó la
had
importancia de
Dr.
avanzar
Leonardo
hacia la
Rojas, who
estandarización en
highlighted
modelos
the
de
importance to move
implementación
toward the
y mostró
standardization in
el
the
marco
models of
regulatorio del
implementation.
Perú
And he
como
talked
ejemplo de
about the
todos los
regulatory
cambios que han sido
framework of
impulsados
Peru
a
as an
partir de
example
la
of all the
pandemia.
changes that have been promoted
Explicó
since the pandemic.
casita de telesalud,
He
que es muy interesante,
explained
que integra
that
política,
telehealth,
gobernanza,
digital
infraestructura,
house that
que ayuda
integrates
como a
governance,
organizar
infrastructure,
todos
and
los
all of that,
conceptos
that helps to like
fundamentales
putting together all the
de las
fundamental
iniciativas.
concepts of
También
all
habló de la
digital
necesidad de
initiatives.
invertir
He
el
also
personal de
referred to the
salud y en
need
su
of
optimización para
investing
garantizar la
in
calidad de los
healthcare
servicios,
staff to
el valor
guarantee
de la
service quality,
teleinterconsulta que
the
permite de manera
value of
significativa
interconsultation, which certainly
reducir los
allows
tiempos
to
de
reduce
diagnóstico. Muy interesante, por ejemplo,
diagnostic
eso que
times,
habló
which
sobre
is
cáncer.
interesting because he talked about cancer, and that is
Recordó
covered
también que
in
la
there.
atención en la
He
telemedicina
also
no
reminded us
sustituye la
that
atención presencial,
telemedicine
sino que
care
la
is not
complementa
replacing
y que
in-person
puede
care, but it
generar ahorros
complements
en
it,
eficiencia y
and it
sobre
can
todo
generate
salvar vidas.
savings in
Por
efficiency and
parte de la
save
doctora
lives.
Mariana
Dr.
Ramírez
Mariana
compartió la experiencia
Ramirez,
de Bolivia,
on the other hand,
donde la
also
teleconsulta
shared
pasó de
about
ser
Bolivia's
un piloto a
experience with
convertirse en un
telehealth
programa
stop
robusto y parte de la
being a
Red Nacional
pilot
de
to become a
Atención
robust
Integral en
program
Vivo
and part of
2019,
the
el
whole
Sistema
network
Único de
program
Salud,
since 2019 with the
em,
single
que tiene
uh,
telecentros en zonas
telehealth
remotas y ha impulsado
healthcare program
iniciativas de
with telecenters in
telegerencia,
remote areas,
teletecnología y
with
teleeducación con
telemanagement,
impactos muy positivos
teleeducation, with
en
very positive
muchas áreas de
impacts
la salud
in
pública, como
many
salud materna,
areas of public
infantil,
health care
crónicas
as maternal, children,
y
chronic diseases,
discapacidad.
and
Y
disabilities.
en Bolivia la telesalud ha ayudado a
And
mejorar la
in
cobertura
Bolivia,
de diagnósticos y ha
telehealth
favorecido
has
la detección
helped
temprana
the coverage,
de casos,
the
contribuyendo a hacer
diagnosis,
una
the
realidad el
early care of
derecho
many
a la
cases
salud y la equidad y la
to
universalidad.
contribute to
Entonces,
equality and
ese es
global
un breve
coverage.
resumen.
So that's pretty much a short summary of this webinar, which is part of a whole schedule of digital literacy in healthcare that will continue on November 11th in the morning with data governance in public health. Something very interesting. I recommend September 18th with a session dedicated to civil records and vital statistics, and then in an era of digital interdependence. And very soon we'll share this schedule, the second part of this course with artificial intelligence and public health intelligence as well. Thank you so very much for your participation. Thank you so much for your time. Have a great day.